The final diagnosis, Dr. Amanda Fletcher, was a well-respected physician at St. Harmony's Medical Center in Richmond, Virginia. Known for her sharp intellect and no-nonsense attitude, she had built a reputation as a skilled diagnostician. But behind the white coat and clinical demeanor, Amanda carried biases she never cared to confront. It was an unspoken truth among the staff she treated her black patients with less patience, less care, and often less respect. One Wednesday afternoon, Amanda was finishing up her rounds when she was called to see a new patient. She sighed, annoyed by the interruption. "Room 305, a nurse said. "A Mr. Carter has been admitted with severe chest pain." Amanda walked into the room, clipboard in hand. Sitting on the bed was a tall black man in his late 30s. He was dressed casually in a plain gray t-shirt and jeans, his muscular frame tense with discomfort. His skin glistened with sweat, and he looked up at her, anxious but polite. "Good afternoon, Mr. Carter," Amanda said, her tone cold and clipped. "What seems to be the problem?" "I've been having chest pains," he said, his voice steady but strained. "It started yesterday, but it got worse after work this morning." Amanda raised an eyebrow, barely hiding her disdain. "And what kind of work do you do?" she asked, her tone sharp. "I work in security," he replied. Amanda scoffed internally. Of course he does. She scribbled something on her clipboard without looking at him. "Well, chest pain can mean a lot of things. It could be heartburn, stress, or something more serious. But people like you," she paused, catching herself, "often exaggerate symptoms." Mr. Carter frowned, his polite demeanor dimming slightly. "I don't think I'm exaggerating, doctor. This feels different. It's like a weight pressing on my chest." Amanda waved him off. "We'll run some tests. But honestly, you look fine to me. You probably just need to change your diet and exercise more." The man didn't argue, though his jaw tightened. Amanda ordered a couple of basic tests, dismissing the possibility of anything serious. The revelation an hour later, as Amanda reviewed the test results, stomach dropped. The EKG showed clear signs of a heart attack. She rushed back to room 305, her mind racing. How could I have missed this? When she entered, Mr. Carter was seated calmly, scrolling through his phone. He looked up, his expression unreadable. "Mr. Carter," Amanda began, her voice slightly shaky. "Your test results indicate that you've suffered a heart attack. We need to act quickly. I'll arrange for immediate treatment." He nodded, his face calm but serious. "Thank you, doctor. But before we proceed, there's something you should know." Amanda froze. There was something in his tone, a quiet authority that hadn't been there before. "I wasn't completely honest earlier," he said, setting his phone down. "When you asked about my job, I said I work in security." "That's true, but I didn't tell you where." Amanda frowned, confused. "What are you getting at?" He leaned forward, his piercing gaze locking onto hers. "I'm the head of security for the U.S. Department of Justice. Specifically, I oversee investigations into civil rights violations, including cases of racial discrimination in healthcare." The color drained from Amanda's face. "I've seen the way you've treated me since I walked in here," he continued, his voice steady but firm. The dismissive tone, the assumptions, the lack of urgency. "If I didn't know better, I'd think you were trying to downplay my symptoms because of my skin color." "Mr. Carter," Amanda stammered, her mind scrambling for a response. He held up a hand, cutting her off. "Save it. I'm not here to ruin your career, Dr. Fletcher. But I hope this serves as a wake-up call. One day, someone might not survive because of your biases. And when that day comes, you'll have to live with it." Amanda stood frozen, her clipboard trembling in her hands. The weight of his words hit her harder than anything she'd ever experienced. For the first time, She was forced to confront the ugliness within herself, the prejudice she had long ignored. Epilogue. Weeks later, Amanda attended a mandatory training on implicit bias, a requirement for all staff after Mr. Carter filed a formal but private complaint with the hospital. She sat in the front row, listening intently, her mind replaying their encounter. Meanwhile, Mr. Carter recovered fully and returned to his job, though he never crossed paths with Amanda again. His words stayed with her, pushing her to become a better doctor and a better human being. Sometimes, the most painful diagnoses are the ones we make about ourselves.